I identified 3 different groups of spirits involved in Mike's case. We had one he called Scars in the Brain.
Mm-hmm.
We had Earthbound, several hundred of them, led by a spirit called Samantha. And at the end we had a negative entity of some kind, which we didn't identify.
Right.
So which of that lot were causing the voices?
Well, first of all, I wouldn't say that there was several hundred in the background. I wouldn't say that. I also wouldn't say that there were any different kind of different associations. I'd say they all belong to the same group. Those scars in the brain were how I visualised what the voices were leaving behind, or how they manifested themselves. When I was in the state I was, I looked up at my head, and whereas the rest of me seemed to be bathed in light, this was murky. It was muddy, it was dark, it was foggy. I couldn't see any light beyond it. The manifestations, the scarring on the brain, is what the voices, for me, how I visualise them. It's like there were entities sat on my brain causing perhaps a lot of my thinking to be very negative by introducing comments, words, etc., which they've done for the last 20 years.
So would you say that it's a form of symbolic representation?
I wouldn't. It's difficult to say, because you're in a state where you're open to the possibility that that could be it, but you're also negotiating with the possibility that it is the spirit realm.
These voices had character because you described one of them as being female.
Yeah, definitely.
So the others were presumably male.
Well, there's about 2 or 3 that were female, but I've had for the past 20 years about 4 or 5, 6 voices. When I stood on that canal path and listened to them and turned my head where they were coming, about 2 or 3 females, about 2 or 3 males as well. You can't turn around because you can't see them. You can't log a definitive. I haven't logged them, so gone. The inflection of that voice is male A. The inflection of that voice is male B. The inflection of that voice is female C. It doesn't work that way. You hear the voices. You know the female voice from the male voice because the hertz zone that it operates in. I hear the voices, and there's about 4 or 5 distinct different ones. 2 or 3 female, 2 or 3 male. Now when I was in that trance-like state, I envisaged them sat on my brain as some kind of scarring on the brain. That they were entities that were sat there. If you want a better word, like a cancer. Like 4 or 5 different cancers sat in my brain. When Terry and Andy got involved, and they said, let the light devour them. Or that's how I envisaged them. The light was devouring that dark, kind of cancerous entity, for want of better words.
Now you see them differently, don't you?
Yeah, I sort of see images really.
This was an image,
Yeah.
but it's how I manifested them. I also saw on the top of my brain, like an eye, a dark eye.
Yeah, you described that.
Yeah, which was looking in. It was looking in and watching it all, but it was coy. It didn't want to open up usually.
Well, I actually see it. So if I'm looking at discarnate spirit, so when we talked to Samantha, I could see her looking at you.
Yeah,
and I whispered into her.
But she was an Earthbound.
I could see Samantha.
Yeah.
I could see Samantha. When she turned away, I could see her head. I don't know how you visioned her, but for me, she had like blonde hair.
Long blonde hair.
Yeah.
So she just looked at me as if to say, well, they don't realise that we can see
Where
them.
do you come from?
Yeah, and it's almost like, now you're talking to me, but I'm talking to him, type thing. And that was when I think she stopped talking to you, and then she was obviously having a dialogue with me, effectively.
Yeah, she did turn away from me. I could see her head turned away and towards you, and that was before Terry introduced you. So you were already, I guess, engaged. Yeah.
You always got, yeah. But telling the difference between DFEs, dark energies, negs as you call them, and an Earthbound. There is a distinct difference there. You visualise Samantha, the blonde-haired woman, as a person, as a human being.
No, that just came into my head.
Right.
I didn't visualise Samantha. I visualised the voices as being the cancers on my head, on my brain.
Which is
the
a
scarring.
different visual representation altogether, isn't it?
I think when you were talking through it, you were asking, is there anyone left? And that's when Samantha popped up. Whether Samantha's connected to these scarrings, I don't know.
No, she wouldn't be. Because what we're dealing with here, my interpretation of it is I see, and because I don't see, so I can only imagine, I'm working on 3 different levels. There's the level of the negative entity, the DF, the dark force entity, which are non-human, destructive, mean only harm and ill will. And those are dealt with first. And it doesn't matter what form of therapy you are going to employ to help a person, whether it's psychotherapy, hypnosis, or any of the different schools, NLP, whatever mode of therapy is going to be applied, is doomed to failure all the time you've got those DFEs in there, the negative entities. They will prevent anything from working. Okay, so that's the first thing that's got to go. The next level I work on is the earthbound level, and you don't have to be sick to have an earthbound. Anyone can be carrying out, because earthbounds can be attracted to any of us. They're attracted by our own lives, and if you're a compassionate, caring, helpful person, a loving kind of person, then the lost earthbound will be drawn to you for that comfort, for that reassurance. So, and this happens to a lot of people, and they can be carrying an earthbound spirit without ever realising it, and I've come across quite a lot of those.
These particular earthbounds were quite clear that they were doing harm to Mike because they apologised for it.
Yes, well, what I was referring to there was the opportunistic earthbound that suddenly finds itself out of its body, doesn't know where to go, and attaches to a person with a light. But then you can extend that situation to the battlefield, to catastrophes, to natural disasters, where a lot of people suddenly die in a situation, and it takes them by surprise. There's a flash of light, they don't know where to go, they're lost, they're earthbound. But they were still attached to someone for a level of comfort, and that person will not know they're there. And without deliberately wanting to cause problems, their presence may have an effect. Like Samantha was apologising because she felt that she may have caused some distress, but it wasn't her intention to cause distress, it was just...
Yeah, I think as Richard says, so they know that they are taking your energy, and therefore that is having a negative effect on your, your medical.
But they don't know how to get out. They don't know how to be released. So, going back to what I was saying a moment ago, we deal with the DFEs first, get them out of the way, and then we deal with the earthbounds. And once the earthbounds are dealt with, if there are any deep-rooted psychological issues that need to be attended to, with dissociated parts, subpersonalities, because people, especially in childhood, who are abused in some way, they have a natural defence mechanism where they dissociate from the trauma, and it protects them from the pain. And that process actually creates dissociated subpersonalities that maintain an autonomous conscious state. And as the person grows older and more mature, so that dissociated subpersonality remains there, the hidden child part, if you like. And a person can have several of these dissociated subpersonalities. Dissociated subpersonalities can also be brought from a past life trauma into this life. So after the DFEs are dealt with and after the earthbounds are dealt with, then we go into the deeper realms of the subconscious and negotiate and find those sometimes families
Indeed.
of hidden parts.
Right. In Mike's case,
We didn't do that.
we have very little detail about Mike's life.
Yeah.
That we know he's been in the army, and he's been in the Balkans. And you did mention PTSD at one point.
Yeah.
Are you suggesting, Terry, that Mike needs to have some more psychotherapy of some kind to deal with PTSD and possible, as you say, dissociated subpersonalities?
I don't know the answer to that question. I'm not going to assume anything. But the only person who would know the answer to that question would be Mike himself.
And I was just about to say, the way I feel at the moment, I'm going to run around Billy Go naked in the full moon shouting freedom. If this continues, because I really am feeling no intrusions for the past 40 minutes an hour. I think I'm going to go out and celebrate for a while, and then if over the next month or so I get recollections back that are PTSD issues, then I will address them.
Yeah.
But I'm just really glad at the moment. It's beginning to dawn on me. It's only about an hour ago.
It takes a little while to sink in, doesn't it?
Yeah, but I'm beginning to sense some kind of freedom for the first time in 20 years. So.
Brilliant. That's the whole point of it, I think, and that's something for me personally, is that the reason, I put my time doing this is to help people, because there's a big gap between what's actually happening from a financial perspective with health services and social services and those sorts of people. And while we know this works, and we know it's cheap, as in there's no cost, there's no drugs, there's no medication, it's just people's time, and the difference you can make is phenomenal. For me, it's a real shame that this hasn't kind of percolated into the medical system as yet, really. It definitely needs to happen.
Yeah.
We should probably note for the record that in Brazil, these services are on a large scale, many institutions doing this sort of work, and it's all offered free, as I understand it.
It is, yeah.
Is there any kind of statistics, tally sheets, or anything that's saying it's a success? Or are they finding it's...
In Brazil?
In Brazil.
In Brazil, they've been using these techniques in institutionalised psychiatric hospitals since the 1930s.
Okay.
Now, why isn't that common knowledge here?
Has the evidence been correlated to suggest that it's working?
Oh, yeah.
Then it should be knowledge here.
Well, of course it should. Emma Bragdon is...
It's very limited in English, Terry, isn't it? That's the problem. A lot of it's in Portuguese, not
Yeah,
accessible
because
to the
it's
English-speaking world.
But every 2 years, the Brazilian scientists who investigate these, and the psychiatrists who investigate these methods, every 2 years they come to London to hold a conference to educate our doctors.
Yeah.
Every 2 years they do that.
But it's also clear from what I've read about Brazil is that they've also got an ongoing battle between the standard psychiatry services who completely rubbish all the spiritism work that's done, and in fact instruct their patients not to go near anyone who does this kind of practice.
Yeah, well, that's self-interest, isn't it?
Well, it may well be. They may have all sorts of motives for it, but I'm saying that the battle is not won there in any sense.
No.
It's not a foregone conclusion. There's lots of help, but you've still got to go and choose it. It may be in the face of instructions from your
It shouldn't be a battle. The way I think it should be, I think this kind of therapy should coincide, should run hand in hand, parallel, as opposed to both branches of, say, medicine, for want of better words, battling it out, science versus religion and all this, that and the other. If this is working, then surely it should be a branch of medicine or a branch of therapy that runs hand in hand with psychiatry. Because I don't doubt that I've got psychiatric problems, such as PTSD, possibly depression. But the thing is, it's easier to understand when you realise that a lot of it is triggered by this ethereal world.
Yeah.
The best example I can give, all these medicines that you take when you're a psychiatric patient, they ameliorate the symptoms. They stop things such as paranoia, ideas of reference, suicide ideation, things like that. But you still have those trigger factors. Now in a PTSD case, a lot of it is down to the PTSD itself, which is very organic. But if you are suffering from ethereal kind of, voices, etc., intrusions, they are bound to trigger the ideas of reference. Because your brain, I might be thinking about going over there and picking up a phone off the table. But as I'm going over there to do that, if a voice comes in and says something different, I'm going to lose train of thought for a moment. And the way the brain operates, my suggestion is, it's like drop-down menus. One thought leads to another, etc., etc., etc. Now, the medicines, what they'll do is they'll stop that paranoia that can evolve from those triggers, but it doesn't get rid of the triggers. Now, this is why I'm thinking that this kind of therapy, if it works, it's proven it's working, if it went hand in hand with psychiatry and they opened up the doors and their ears and their hearts and their minds, then it could run hand in hand and they'd have a greater success rate than what they are doing now. That's my suspicion anyway.
It's almost a shame, I think, as well, is that people aren't paid for performance, really. Because if people have a problem and they take medication, it doesn't resolve the problem. If they weren't paid for that and you only paid for results, everything would turn around immediately, wouldn't it? Because suddenly you wouldn't give medication if it doesn't work. Some of the medication does work. If it doesn't work, you then try something different because you're actually looking for the result that you want rather than the financial reward that obviously comes with the material world, effectively.
Unfortunately, one of the results that psychiatrists are happy with is to keep crazy people off the streets and keep them from disturbing the rest of the population. So, I mean, the person, all you're doing is suppressing symptoms for that person and keeping the rest of society happy. It's not curing anyone.
When all of society becomes crazy, what do you then do?
There's more and more people demonstrating ill health, which is to do with the mind or beyond, as a society.
I think, so the problem, I think the medicine in general, and I think the psychiatric services is typical. How does it integrate the organic function of your body to your spiritual way? If you start looking more together, probably things get much better because they don't consider the your spiritual your mental states. It's just you try to treat your body as you're completely separate from one to another. I think like a education, even, and I'll talk about before the religion, even if you think about majority population, they might have some kind of belief or religion, but even then, when it comes to treat your body, the separate things, it's like kind of the spiritual is one part and your body is another part, but if you start to look like how these things influencing the function or the organic function of your body, maybe things could be much better.
If there are any important comments that anyone would like to make, now would be a good time.
Is that if you're a sufferer, at the end of the day, don't give up exploring all aspects of what could help. Because I know I've been in the past suicidal, and I have made serious attempts to take my own life. It need not be that way. You just got to keep going until somebody or yourself steers you into something like this, at the very least. Just don't give up.
What would you like to say to finish off with? Anything? Sarah?
I think I agree. I'm not certain about on parent, but I think I could tell the parents if they got children, their children suffer from mental health. Is the saying, don't give up.
Don't give up.
Look for different alternatives. If one are not working, try something else. And I think you should, look more carefully about, the work Dr. Palmer and Andrew have been doing.
Yeah, without doubt.
I think it would help a lot of people. And I've seen a lot of young people, and my son was in a hospital, and majority young people there, and I think you could do much more for them. I think their life would improve much more if you have more, looking more carefully too.
Yes, I could add that I had depression for over 40 years, from the age of 18. And as Mike says, I went on looking and trying all kinds of different therapies. I mean, a huge long list of therapies I've been through. But I went to see another spirit release therapy earlier last year, and we worked through all this same kind of stuff. And now I'm off medication completely, and as far as I can tell, the depression is gone. It takes time to prove that. I mean, you need to leave it for probably 2 or 3 years to be dead sure that it really has gone. But I'm appear to be fine on no medication, which is complete change. Previously, I've been taking antidepressants for 25 years solidly every day.